Thank you. Welcome to South Today. Monday again. Here's what's coming up now, but between now and 7, how your help is needed to save lives. Alison Cleghorn died just 4 weeks after being diagnosed with pancreatic cancer. Now the pioneering blood test being trialled to spot it early.
It is an extremely common cancer, diagnosed very late in most people. So these sort of tests are so important to us, so important for everybody who might be touched by pancreatic cancer.
But almost 30 people are diagnosed with it every day in this country, and it's our 5th biggest killer. Very good evening to you, I'm Edward Salt. A new blood test trial is being pioneered here in the south, which it's hoped could improve the early diagnosis of pancreatic cancer. It's one of the most undiagnosed forms of the disease, and yet, if detected early enough, is one of the more treatable. 10,500 people are diagnosed with pancreatic cancer in the United Kingdom every year. That's almost 30 people every single day. That makes it the 10th most common cancer in the country. But it's the 5th most likely cancer to prove fatal. Why? Well, because its symptoms are often vague and can be put down to other illnesses such as diabetes. The trial will test blood samples from people over the age of 50 and who've recently been diagnosed with type 2 diabetes, a known risk factor and a potential indicator or symptom. Alan Sinclair has been to meet one man who knows better than most the shocking speed with which pancreatic cancer can devastate lives.
As far as we were aware, Alison was having sort of mild indigestion symptoms in the summer of 2020 that everybody has at some point or other. But then she started developing what I guess you call classic diabetes symptoms. She was diagnosed with diabetes in mid-November 2020. Again, a real surprise to us because she was healthy, we had a really good diet, and we thought that very unusual.
What they then learned was that unexpected type 2 diabetes, in a fraction of cases, is a known indicator for pancreatic cancer. They pressed for tests, which confirmed their worst fears.
She was formally diagnosed then on the 23rd of December in 2020, but sadly died 4 weeks later, very, very quickly and very soon after that diagnosis.
Since Alison's untimely death at the age of 54, Sean, their 3 children and wider family and friends have raised thousands of pounds in her memory to fund research. And today, Cancer Research UK's Southampton Clinical Trials Unit is beginning a major study which could potentially speed up the diagnosis of future cases by fully investigating that link to diabetes.
Pancreas is a difficult organ to reach, and therefore, when cancer develops, it doesn't present until late when it is spread. Second thing is that pancreatic cancer is an aggressive cancer in general. So when it's reached a stage where there are symptoms, in most of the cases, they are not suitable for surgical resection.
At present, just 1 in 10 cases of pancreatic cancer is detected early enough to enable treatment through surgery and chemo. The hope is a simple blood test for people with diabetes could find those at greater risk, crucially speeding diagnosis, potentially saving lives. The trial needs volunteers in their 50s, recently found to have type 2 diabetes, but they're keen not to cause unnecessary worry.
99% of those people, they don't have a cancer. What we are looking for the small proportion of people who are 1 in 100. These are the people that we are interested in, and these are the people we need to study. Then we can offer them earlier treatment and better overall outcome and survival.
I think if Alison potentially had been diagnosed a little earlier, we may have got more time. She may have had the chemotherapy, but she would want this not necessarily to be about her. She wanted to be about the future. And I think giving hope to other people.
Sean Cleghorn finishing that report from Alan Sinclair, and we thank Sean for talking to us. Well, anyone who wants to find out more about potentially supporting the study can find details on the website of Cancer Research UK's Clinical Trial Unit in Southampton at the address which is on your screen now. That's safe-d.uk. Well, volunteers can organise when and where to provide a simple blood sample. They're initially seeking 800 people, but the 4-year study will ramp up eventually to involve 15,000 20,000. So they really do need your help. And I'm sure it's a story we'll keep across here on South Today.